Hi, so we're so excited to announce that we've officially completed our first research study here in Little Old Fresno. We are very excited for this. The KP Cares research study is co-led by investigators Kate Garsky, RN, and Kirsten Obar, RN. Linda Ackerman served as a regional PI with her support mentor Michelle Kamisha. Wendy Gospanetich and myself, Deanna Ibarra, we were the nurse leaders, site, and principal investigators here in Fresno. So today, Kate and I are going to share our KP Cares research study process and conclusions with you. The KP Cares Kaiser Permanente Caring Attributes of Resilience to Stress is a mixed method two-phase research study that includes qualitative measures and also quantitative measures. The research study included 11 medical centers here within Kaiser Permanente, Northern California. The study participants are all registered nurses employed at the medical center, and the quantitative arm of the study is a descriptive study to assess the impact of enhancing our culture of caring experiential learning modules on the RN self-assessed changes in perception of professional quality of life, self-caring, Caritas leadership, and the caring culture of the organization pre and post intervention. The qualitative arm of this study is to learn the lived experience of the RN and their ability to maintain resilience during COVID-19 pandemic by using a semi-structured focus group interview recruiting from the RN members of our facility's Voice of Nursing Council. So first, let's get into phase one, our quantitative measures. So phase one of the research study includes our qualitative measures. Phase one aims at focusing on a single group pre-test, post-test design to evaluate changes before and after completing our Creating a Culture of Caring courses. 20 clinical nurses employed by Kaiser Foundation Hospital participated and completed the Culture of Caring courses. So our research question was, does the implementation of the Enhancing Our Culture of Caring module series experiential learning program result in improved outcomes in the nurses' self-assessed score on Watson Caritas self-rating score, Watson Caritas self-assessment leader score, Watson Caritas culture score, and professional quality of life measurement at completion of the program post compared to the nurse's self-assessed score prior to completion of the experiential learning program pre-intervention. So our research hypothesis was we predicted a statistically significant improvement in self-reported self-assessment of self-caring behaviors of nurses and nurse leaders. Our purpose was to evaluate the effectiveness of the Enhancing Our Culture of Caring experiential learning module series. Our aim was to increase the clinical nurses' self-care behaviors and practices to minimize compassion fatigue by providing experiential education program based on Dr. Gene Watson's human caring theory with the 10 Caritas processes. The objective was to assess the effectiveness of our Enhancing Our Culture of Caring course. So here's the method that we used for our phase one. The first step was IRB approval was received. Participants enrolled in the Enhancing Our Culture of Caring experiential learning series. This was a two-part course. We obtained informed consent from all of the participants. Participants electronically completed a pre-survey in our Microsoft Forms. Participants attended 2 4-hour classes. Participants electronically completed the post-survey in Microsoft Forms, and participants given a Caritas pins as gifts after they've completed the second part of the modules. And we also did a pre and post scores utilizing and analyzing their t-tests. Here's a general overview of what to expect in phase one. The participants began with a pre-test before the courses were started, and then the participants attended and completed the Culture of Caring courses. When the participants completed their course, they took a post-test, and then data was collected in a secure platform during that time. So here's a study participant characteristics. So again, 20 nurses participated in the Enhancing Our Culture of Caring courses. The following RN characteristics were collected, including age, length of employment at Kaiser. Here are the learning objectives for part one of Enhancing Our Culture of Caring course. And then here are the learning objectives for modules 3 and 4 of the courses. So these are our results following the courses. So the yellow is how the participants felt before taking our classes, and the purple is how they felt after taking the classes. So here you're going to see the professional quality of life, pro-qual, is a measure to help healthcare workers monitor their emotional health when working in difficult circumstances, for example, a pandemic. Three components that are assessed and measured include compassion satisfaction, burnout, and then secondary traumatic stress. So here we see a slight improvement in the compassion satisfaction component. For burnout and then for secondary traumatic stress, we did not see an improvement during our post-assessment. The blue is how our participants felt before taking our class, and the green is how they felt after the class. So this was assessment of the Watson-Caritas self-rating score, which is a measure of perceptions of self-caring based on Caritas behaviors of loving kindness, meeting basic needs of self, having helping and trusting relationships, and creating an environment that enables flourishing and valuing beliefs and faith to promote success. So the Watson-Caritas Leader Self-Rating Score is a measure of human-to-human caring and other experiences working with the nurse. The Watson-Caritas Organizational Cultural Scale is an instrument used to assess human-to-human caring experience within the organization. So in all three, you're going to see a slight improvement following the courses. So here are the components of the Watson-Caritas Self-Rating Score. I treat myself with loving kindness. I practice self-care as a means for meeting my own basic needs. I have helping and trusting relationships with others. I create a caring environment that helps me flourish, and I value my own beliefs and faith, allowing for my personal successes. And here within all of these categories, you're going to see an improvement in the post-assessment for our participants. So here are the components of the Watson-Caritas Leader Self-Rating Score. So I treat others with loving and kindness. I model self-care as means for meeting the basic needs of self and others in dignity. I have helping and trusting relationships with others. I create a caring environment that supports others' personal and professional growth. I value the personal beliefs and faith of others, allowing for expected and unexpected successes in their role. And here you'll also see that we have improvements across the board for our participants post-assessment. So here are the components of the Watson-Caritas Organizational Culture Scale. So this measures compassionate, caring, and kind relationships are valued at all levels within our organization. All personnel are supported to meet their basic needs with dignity. Personal and professional growth is fostered through a community of caring. Caring and healing relationships with self and others are valued and encouraged, and all personal beliefs and values are honored. So here you're also going to see a slight increase for all of these components, and the same results for the last. All personal beliefs and values are honored. So as results, at the completion of our Enhancing Our Culture of Caring experiential learning program post, compared to the nurse's self-assessed score prior to completion of the experiential learning program, the pre-intervention, we found that participants reported improved outcomes in the nurse's self-assessed score on the Watson-Caritas Self-Rating Score, the Watson-Caritas Self-Assessment Leader Score, Watson-Caritas Culture Score, and Professional Quality of Life Measure. So we concluded that the completion of Enhancing Our Culture of Caring experiential learning program will increase nurses' ability to practice self-care, really foster and build relationships with others, and create a caring and healing relationship, and foster a community of caring. Some nursing implications are as follows. A theory of human caring moves past the scientific practice of nurses to create an authentic relationship framework, and also by providing caring science with scientific care, human spirit and inner healing occur, and nurses discover a more meaningful practice to make a more rewarding career and profession. All right, so now I'm going to go ahead and pass the mic on to Kate, and we're going to talk about our Phase 2 qualitative measures.
All right. So Phase 2 was a semi-structured interview that aimed at evaluating the lived experience of clinical nurses during the COVID-19 pandemic. 5 members from the Voice of Nursing Committee were involved in Phase 2. So this is our research question. Nurses, the largest workforce within the healthcare delivery system, continue to face the demands of caring for patients under extremely stressful situations of the COVID-19 pandemic. Our research question explored the lived experience of clinical nurses working in an organization that utilizes the theory of human caring as the foundation for professional practice working during the COVID-19 pandemic. So our research hypothesis was we predict nurses may share their experience of overwhelm and task orientation because of the pandemic, and the theory of human caring may be a source of stress reduction and resilience. The purpose: explore the lived experience of the clinical nursing staff working during the COVID-19 pandemic. Aim: understand the lived experience of the clinical staff who have been practicing and leading at the bedside during the COVID-19 pandemic. And our objective: explore the lived experience of the clinical nursing staff working during the COVID-19 pandemic at 11 Kaiser Permanente medical centers. Additionally, we will collaborate with Dr. Barbara Brewer to conduct psychometric evaluation of the WCSS, WCSLS, and the WCCS. So these are our study procedures. They began with the recruitment. Members of the Voice of Nursing were invited to participate in the focus group. Informed consent was received. Focus group participants selected a unique identifier. Regional PI moderated local PIs took field notes. Participants' informed session was being recorded and that they may leave or stop participation at any time. It was a semi-structured interview with probing. Session concluded upon saturation of the data, and the participants were thanked. So 5 members of the Voice of Nursing Committee participated in the focus group. It was a 90-minute session. We focused on what was the impact of the pandemic on you personally and professionally. How did your nursing practice change during the pandemic? How did the theory of human caring science impact you personally and professionally? Since you participated in the Enhancing Our Culture of Caring program, how has your experience as a nurse changed? And what self-care practices did you utilize to increase resilience during times of stress? So Kaiser Permanente, Northern California, the largest Watson Caring Science Institute affiliate in the world, began the journey to embed the theory of human caring as the foundation for the nursing professional practice framework in 2010. The theory of human caring was chosen as the ethical foundation for professional practice and was enculturated to provide a shared theoretical framework, guide professional nursing practice, and deepen the ethical humanistic covenant of caring for self, others, and system across the 21 medical centers in Northern California. So our results were that Kaiser Permanente, Northern California, the largest Watson Caring Science Institute affiliate in the world, began the journey to embed the theory of human caring as a foundation for the nursing professional practice framework in 2010. We identified the lived experience of clinical nurses working in an organization that utilizes the theory of human caring as a foundation for professional practice working during the COVID-19 pandemic by identifying themes and sub-themes. So these are the different themes and sub-themes: trust, organization leadership, and the public health organization, self-care, no time for self-care, teamwork, being there for each other, fear involved contracting COVID, exposing vulnerable family, and losing patients, isolation and rejection involved community and family, resiliency and personal growth involved personal growth and professional growth. The theme, trust. These are quotes from the individuals involved. We went to war with no weapons. Nobody rescued us. Constantly changing protocols. Limited resources and supplies. Limited PPE. Forced to reuse single-use PPE. And limited help from our management team. So under the self-care theme, it was no time for self-care. We ran on empty. Nursing was my life. A majority of our patients did not make it, and we became everybody. Under fear, it was the fear of the unknown, fear of dying and getting sick, fear of bringing COVID home to our loved ones. Under isolation and rejection, our patients were dying alone. Our kids were rejected from other kids because their parent was a nurse in a hospital. Our family did not allow us to visit because we were healthcare workers. Under teamwork, it was learned how to survive with each other. Nurses became each other's support. We got through it because of us. Strength together, we are warriors, and improved teamwork. Under resiliency and personal growth, there was improved family bond and unity, improved faith, found personal strength, humbled, improved efficiency, and adjusted quickly. So in conclusion, nurses working in an organization that utilizes the theory of human caring as the foundation for professional practice working during the COVID-19 pandemic demonstrated improved teamwork, personal growth, professional growth, family bond, and resilience. So our implications for the nursing practice. The staff nurses expect transparency, honesty, and support from leaders during a pandemic. A lot of healing needs to occur within the profession during and after a pandemic. Leaders must acknowledge and support nurses as they address the impact of the psychological insults to sustain their physical and mental health and overall well-being by not fostering the nurses' ability to engage in authentic, caring, healing relationships with their patients. As with the COVID-19 pandemic, we may be placing nurses at greater risk of developing physical and psychological symptoms leading to burnout and subsequently leaving the profession. An important individual approach to promoting well-being and resilience begins with self-care. Nurses must practice self-care to develop and sustain resiliency, diminish job stress, and ease emotional stress. So our limitations were that we had a small sample size, voluntary response sampling, participants self-selected, not all units were represented, and only inpatient units were represented. So we wanted to acknowledge Dr. Linda Ackerman and Dr. Michelle Kamisha, as well as Jeanette Ferrer and June Taylor from Vallejo. And we'll end saying maybe this one moment with this one person is the very reason we're here on earth at this time. And that's by Jean Watson.
All right. Thank you so much, everybody, for allowing us to share our experiences and our project. And we're just making lots of changes, and we couldn't have done it without you. All right. Thank you so much.